You're listening to the RC Executive Lounge podcast, the show where healthcare revenue leaders share real-world strategies, hard-earned lessons, and bold ideas shaping the future of revenue cycle. The views expressed by guests are their own and do not constitute endorsement of any specific product or solution.
Hi, everyone, and welcome to another episode of Season 2 of the RC Executive Launch podcast series. I'm your host, Praveen, and I'm really glad you're all joining us today. I'm going to be introducing a guest who I've been very excited to speak with today, Thomasina. Thomasina has over 25 years of experience as a cross-functional healthcare business operations subject matter expert. She has extensive experience leading day-to-day engagements in a variety of healthcare settings, including academic medical centers, safety net hospitals, and multi-specialty physician groups. Thomasina Wilkins has served as senior leadership, managing up to $400 million in net patient revenue monthly, serving domestically in the United States as well as internationally. Thomasina's experience includes managing healthcare financial and clinical engagements across the nation. She is most known for her approachable coach personality and ability to strengthen and bring together diverse teams to create a successful, positive, and productive team environment. Key project initiatives include revenue cycle enhancement, artificial intelligence implementations, and workflow optimization. Specific areas of focus include patient access, HIM coding, patient financial services, CDI physician and RN clinical documentation improvement, charge capture, denials management, revenue integrity system conversions, and most importantly, compliance training. Thomasina has led multiple performance improvement and financial transformation engagements, partnering with leadership in public and community hospitals to implement process changes and drive sustainable financial results and an enhanced clinical patient experience as a team. Thomasina recently authored a comprehensive cross-functional clinical best practices and financial denials prevention handbook for the Abu Dhabi public health system in the Middle East. She also assisted in the implementation of first physician and nurse clinical documentation improvement revenue integrity compliance program in the region. Thomasina currently serves as a senior trusted advisor, leveraging strategic business intelligence analytics as a key factor in assisting organizations around the US. Thomasina holds clinical credentials, is a certified billing and coding specialist, certified electronic health record specialist, and is formally trained on over 30 plus healthcare information intelligence systems. Thomasina is a known subject matter expert in the industry and was recently named one of Becker's top women to know in the IT in the country. A featured speaker at Becker's Healthcare, Health IT, and RCM annual meeting, Thomasina has shared a philosophy that captures how she approaches revenue protection. When I think about what brings cash in the door, it is proactive loss mitigation. Utilize your system to proactively mitigate through. We'll talk today about her journey to the CRO seat at a mission-driven safety net system, how she thinks about AI and automation in the revenue cycle, her international perspective on revenue integrity, and what health systems need to do right now to protect and recover revenue. Now, let's welcome Thomasina Wilkins. Thomasina, welcome to the show and thank you so much for joining us today.
Thank you.
Let's jump right in. So, Thomasina, most organizations have claims denial management as a multi-year ongoing initiative. Now, you have very extensive experience in this field. How does it work in your organization? How do you determine priorities for this program? And in general, what is your framework for approaching a program of this scale?
Well, I will share with you that each approach is different based off of your organization. First and foremost, you have to keep in your line sight your mission. So although you may have a full toolkit of things to be able to utilize, you have to make sure that it is in alignment with your mission. It is in alignment with revenue integrity. And it is a strategic approach that you are definitely rolling out in terms of partnership across the organization. So when I think about what do we choose as a priority, you first start with what are the barriers to cash collections? If we're talking about claims management and denials, that's a good place to start. What are you losing at the end of the day? What is your margins like, right? And when you start to look at that and peel back the layers of what that is, you start to realize at a domino look, what are the highest to the lowest priority based off of the return of investment? Meaning, if your denials at the end of the day are always medical necessity, or they are authorization based, right? You want to look at your volumes as well as your actual dollar amounts. And then based off of that, you can strategically align yourself with what are the root cause and start bringing in your partners a little bit earlier, showing that framework as to revenue cycle is all of us. It does not start at the back end. It starts at partnership. It starts at mission. And that's how you start to pretty much get your strategics together in order to be able to see that full picture of what you need to do in order to obtain success.
Makes sense. And again, going back, you have quite a bit of experience in this area. So in your entire experience in this area, what have been some of the top reasons driving denials? Like what patterns have you seen or observed in data across multiple organizations?
Absolutely. So one of the highest is definitely medical necessity, right? There is a gap as to, what our payers define as medically necessary and what our clinicians, the person that we have entrusted in with our medical care on a day-to-day basis, sees as the approach in order to make sure that our patients are taken care of safely and with integrity on a day-to-day basis. So I think that this will be one of the top things that will be seen around the country, not only at my organization, which is a safety net hospital, where we see most of the sickest and vulnerable patients every single day. But this is one of the top denials that you will continue to see. This will never be at the bottom of the list. And why? Because it's a wide interpretation on what's medically necessary, right?
Yeah.
The payer may say, okay, this is what the data shows, this is what the benchmark shows, but your clinician, the person that you're seeing, the educator, the person that you entrust with your care every single day, will be the one who makes that choice. And at the end of the day, it may end up in denial, right? Because it's not the usual and customary approach. And as a person who is leading the charge in medicine, they may say, in this instance, there was a different way, a different approach, a holistic approach, a more advanced approach in order to treat this patient. And I agree with it. That does not mean that the payer thinks or concurs with that conclusion. And that is why it will forever be one of the top denials that you will see. And you may have to advocate on behalf of the patient or your organization in order to make that case.
Makes sense. And we have talked to a lot of organizations, and when you look at the typical denial rates we have heard from them, it ranges with something as low as like 4%, and it goes as high as like 27%, right? Now, when you look at up and coming technologies like Agentic AI, and assuming that some organizations are implementing Agentic AI and operational changes, what do you think is a realistic target most organizations can aspire to be when they think about denial rates?
Right. When we think about denial rates, we have to be clear. Are we talking about initial denial rates or are we talking about final denial rates? So making that determination makes a difference, right? Your initial denial rates is what you should be looking at because that helps you to prepare for what your goal is. You have to look at what your performance is now and to be able to gauge what is that benchmark that you want to get to later. And when you start looking at what are the metrics behind that, you have to look at what are like facilities, what are their metrics around the country, and being able to have that data in hand lets you know. Now, you can say on a conservative, from a conservative perspective, right? 4% is ideal for final denials, but it is not I would say, a reasonable denial rate to expect on your first time out the gate, right? Organizations are not perfect. They cannot predict payer, I would say payer behavior. And of course, there's that gap in terms of medical necessity. And because of that, your first time out the gate will not be that 4%, but your goal should be, right?
Yeah.
So always have that marker as to what are like facilities. If you're an academic facility, if you are a specialty clinic, then you should be looking at metrics and marks that are alike with the facilities or the organizations in your geographical organization, right? But right now, from a conservative perspective, I would say 4% is a good marker for your final denials. with the intent that you should look at your initial with the understanding that any barriers that you see, meaning sort those out between preventable and non-preventable. And those things that are preventable, those are the things that you take as a high priority and make sure that you advance strategically on a day-to-day in order to prevent those at the time of service.
Makes sense. And normally, when you look at organizations, there is always this interesting tug of war between your technology team, which is in a way considered as your innovation team, and your operations team, because operations team wants to knock off immediate short-term priorities, and technology team wants to focus on long-term, bigger bets. Potentially, some of them may be riskier bets, but nonetheless bigger bets. How do you manage this tension between the two organizations with whom you typically tend to partner closely?
Absolutely. And this is the space that I live in every single day. I'm a cross-functional executive. So my skill set serves in the median of IT, clinical, as well as financial. So bridging that gap is definitely one of the things that I've been able to engage staff about on a day-to-day, right? Your IT team will definitely tell you about your tools, the things that you can do strategically long-term. Your operational team will tell you what are realistic things that you can implement on a day-to-day. The goal, though, is to make sure from a clinical perspective that you are not impacting clinical care as well as experience.
What does success target look like for a multi-year program like this? Because every year you're going to set a different target. So how do you determine the right target for any given year? And when do you know that in a program like this, you're closer to achieving the final vision?
Yes. So how do you know? Because the numbers are going in the right direction and that's decreasing, right? How do you determine a multi-year project? You have to do it definitely in phases. You also have to gauge whether there have been governmental changes, also payer changes as well. So if in the event that either of those occur, you have to recalibrate. So I would say every 60 to 90 days, the recalibration needs to occur. You have to ensure that you are in alignment with those things that ensure cash collections at the end of the day. If you are not gauging success. And in the event that you're not gauging the success by monitoring, calibrating every couple of months to ensure improvements, then you would be going in the wrong direction. So I think that the recalibration at certain timelines is appropriate, and that's how you get to success. How do you know that you're there? Because you obtain that success, right? And then if you have to definitely go with a different approach, then that means that you haven't obtained, I would say, the ultimate place that you want to be, and that further quality and performance work needs to be done. So the recalibration at certain pinpoints of the project is definitely needed.
That makes sense. That's a great transition point to the next segment. So when we go to the next segment, we're going to be talking to Thomasina about a recent claims denial management initiative that her team led and what challenges they were solving for. Please stay tuned.
When care feels out of reach, patients walk away. Hospitals are left with denied claims and money they cannot collect. RCHQ's Agentic AI cuts claim denials and helps patients set up payment plans that fit their budget, while connecting them to assistance programs like Charity Care and Medicare. Seamlessly integrates with your existing RCM systems with no coding required. Empower patients, protect revenue, increase cash flow. RCHQ, every patient's trusted AI financial assistant.
Welcome back, everyone. Let's jump right in. Thomasina, please walk us through a recent claims denial initiative that you and your team led. Maybe let's start with what challenges were you solving for?
What challenges are we serving for? So around the country, I think as a chief revenue officer and all of the CFOs as well as executives, main thing is to increase margins as well as return of investments, as well as to increase cash collections at the end of the day, while not impacting, your formal mission. So what was the project? I will share with you that around the country, I have talked about this. Most of the time in denials management, you put all of your resources towards the back end. and fixing those things, meaning AR recovery. So what was my approach to this initiative? And it's very unique to my leadership style, my approachable leadership style. And I've really talked about this around the country and at some of the seminars as well in master classes. What was the initiative? Proactive loss mitigation. So what does that mean, right? What does it mean? It means that we are working as partners because revenue cycle is all of us. That means the first time that the patient picks up that phone, we are all partners in that patient's care. We are all caregivers. So in terms of increasing revenue at the end of the day, it requires all of us to be partners and have that warm handoff at every single place in the revenue cycle, whether that being scheduling the patient, making sure that they have their referrals in place, obtaining the authorizations, ensuring clinical care so you have the justification to bill, or even advocating on behalf of the patient at the time of denial to ensure whether it's a medical necessity denial or administrative denial, that they understand the importance of giving the facility the reimbursement that's expected because they did in good faith the service for the patient as well, right? So that was the initiative at the end of, I would say, not at the end of the day, but sometimes when you serve, at the end of the rainbow, I'll just call it at the end of the rainbow, there's sometimes disappointment with, hey, that may not be our scope. For me, it is.
Makes sense.
And that equates to the initiative of partnering with all of your key leaders and your stakeholders, ensuring that they understand the importance of their part in it and how they can impact that pre-bill to ensure success, whereas there is minimal rework. You are on track for your final denial, and that you are recalibrating when you understand that that initiative does not work and it does not align with the mission as well. So that's one of the projects. In my current position, I serve as Chief Revenue Officer for one of the largest safety net hospitals in the state of Illinois. One of our biggest challenges at the end of the day is resources, right? Resources, having enough grants, tools, AI, those things, and right here and now I'm sharing with you. If you'd like to donate to Sinai Chicago, we've got plenty of space for you to be able to donate to our cause. That's one of our biggest challenges. But in terms of initiative, we all work together as a team and under partnership to ensure that that initiative is not only worked by RevCycle, but it has clinical and AI partners and operational partners as well.
Makes sense. And in this case, once you identified the challenge, did you actually work with the partner or was everything implemented in-house? How did you make this decision of build versus buy?
Yes. So when choosing partners, you got to choose your partners very strategically and also early out as well. You have to identify where are your challenges and what are your needs. You should be identifying what can you do in-house and then understanding if you don't have those resources in-house, making sure you partner with a vendor that understands, one, definitely your mission and also what your challenges are, ensuring that they have the resources as well in order to make a good return of investment. Meaning if you're paying them on a monthly basis, then you should receive definitely a formal return of investment. But also choosing those partners are in alignment with your ultimate goal.
That makes sense. And when you went through the implementation, were there any unforeseen pitfalls, surprises, or lessons that you'd like to share with our audience?
Yes, I'll definitely tell you about some of the pitfalls that we've experienced, right? I think around the country, there is a misconception that, denials management, denials recovery starts post-bill. It does not. And I think sharing that understanding with your clinical leaders and your IT leaders and doing a look back at lessons learned and recalibrating your partnerships and sharing that information with them. I think it not only educates them about the work that you have to do on the back end, but it also shares with them the things that they may be able to partner with you on at the time of service. So I definitely do think that lessons learned are determined by definitely doing a data look back to see what were the root causes and sharing that information with every partner the step of the way. And they may be able to share with you, hey, you're looking at that from a back end perspective or revenue cycle perspective, but surely on the front end, I know where that started at. So lessons learned are bring your partners in, allow them to support you in your initiative. And with that partnership, you'll move the needle in order to get to success, your final denials rate.
That's a very powerful insight. Thank you so much for that, Thomasina. So for this kind of a program, during implementation or post-implementation, how are you tracking success and what has been any measurable impact so far?
Yes. So we track success by benchmark KPIs. Now, if the initiative is to increase your point of service sales, you are tracking that benchmark by maybe department or facility and location. Definitely stating what the current performance is from a trending KPI perspective, but also gauging how close are you to success, right? And make sure you socialize that as well. So definitely when I say that we've started at bare bones at some things, first with the implementation of a new system, from a legacy system to a new system, you're going to have some challenges. And as those root causes decrease, cash collections increase. And that's how you pretty much gauge, your success at the end of the day. Are you collecting more? Are your benchmark KPIs moving in the right direction? Are you recalibrating when it doesn't? Are you sharing with your partners and walking across those service lines in order to gauge folks that can help you, in order to prevent things that lead to cash collections loss?
That makes sense. And I think that's a good segue into our next segment. When we go into the next segment, we're going to be talking to Thomasina about up-and-coming technologies like Agentic AI and the impact of these technologies on areas as important as claims renewal management. Please stay tuned.
1 in 5 hospital claims is denied. Behind every denial is a patient delaying care and a provider losing cash. With RCHQ's Agentic AI, fewer denials mean faster reimbursement. Patients get payment plans that fit their budget and access to programs like charity care and Medicare. No coding required to make RCHQ work with systems you already use. With RCHQ, you see an instant increase in cash flow.
We are back online. Thomasina, let's jump into what is one of the most arguably exciting topics that is being talked about quite a bit in the RCM community, which is Agentic AI, right? Now, whichever event you go to today, HFMA, HIMSS, it's all about Agentic AI. So a leader at your level, what role do you see Agentic AI playing in claims renewal management when you look at the next 12 months versus the next 3 to 5 years?
Yes. So I do think that, AI will play a very important role. Now, let's start with where we started, with paper billing, right? With paper billing, I was definitely at the front desk taking in, paper billing, doing charting based on paper billing. And think about it at the phase we are right now. We're at edits right now, but those edits still have to have manual intervention. Now, as we move forward with artificial intelligence, we have a hand in that. That hand is our bots. Our bots will be able to move quicker, faster, be able to support the root causes based off of scripts, and be able to strategically make decisions that typically will require one FTE to be able to decide. A bot will be able to do multiple things at one time in order to be able to move you forward quicker. So I do see a space for artificial intelligence, just as if, we saw at the paper space, this will be a significant change.
That makes sense. And when you look at the application of, Agentic AI in claims renewal management, There are obviously areas where there will be small incremental improvements in the order of like 2 to 5%. And there could be areas where agentic AI could truly bring step function improvement in claims denial management. In your perspective, which areas can benefit the most from using agentic AI to bring that kind of step function improvement in claims denial management?
I would say in the appeals process, most definitely. Here's why. One of the challenges that I've seen is for organizations to be able to determine payer policies and guidelines, right? And so as artificial intelligence is implemented and you are looking at a specific payer that may be denying you, and that payer may be using artificial intelligence at the forefront of their intake. So to be able to respond with the specific clause, also bringing in the provider manuals as well, and also providing facilities as well as clinics with the resources to be able to identify where those clauses are. I think that in the appeals process, it will be very valuable.
Makes sense. And when you're talking about appeals, do you also think that there is maybe an aspect to denial prevention where AI is applicable? Just as a follow-up question.
Yes. So we talked about proactive loss mitigation, right?
Yeah.
And how AI is typically really implemented on the back end for denials recovery. AI should play a key part in the front end recovery as well. If you know that 12% of your claims are being denied, and through the authorizations, let's just say in your final denial, you want to get that down to 4%, then you need to ensure that you have those loss prevention mitigations starting at the process and not after you've already lost the accounts receivables, right? So I do think that in the future state, that it will start playing a key part in defining those areas that require authorizations, being able not only to define it, but also to be able to strategically help you be able to obtain it, referrals, being able to monitor and manage websites as well, in a more faster way than we may be able to do it accurately as humans.
That makes sense. And one last question for this segment. With respect to claims denial management, outside of AI or agentic AI, are there other new up and coming technologies that a leader at your level is watching very closely in terms of how it could impact your organization?
Yes. So what I am looking at is, I would say from a vendor perspective and things that can be brought to the market, I am looking at what's out there, but I am also looking forward to working with vendors who are open to receiving that information. I would say executives at the chief revenue officer or the CFO level or even CEO level has a lot of years of insight as to what are the root causes that pretty much lead to non-collections at the end of the day. And while there are developers who are getting that information right now and developing tools, I think a cross-functional subject matter expert like myself may be able to help in that design process. I would say more so as a think tank as well, because as you start to design things that are the best in class for the market, you need to have that strategic insight as to what's happening. So that pulse is very important. So in terms of things to come that I'm watching for, I am looking for the autonomy within these programs to be able to gauge things that are not already on the table. You'll have your core model there, but I'm looking for the customization. Customization means I am a safety net hospital. I am a rural hospital. I am an academic center. Our patients are being denied due to medical necessity. Those customizable tools based off of your mission as well as your patient demographics or the things that highly impact you from a training perspective, the things that I'm watching for is the vendors and the market-based analysis on who is providing customizable tools to fit organizations' needs.
That makes sense. That's a great segue into the final segment of our podcast episode. Please stay tuned. When we come back, we're going to be talking to Thomasina about the leadership challenges someone at her level faces, Given her depth of leadership experience, this is a segment that you do not want to miss. Please stay tuned.
Every denied claim is money left on the table. Every missed payment is cash flow you may never see again. RCHQ utilizes Agentic AI to lower denials, set up families with affordable payment plans, and connect patients to affordability assistance programs like charity care. Lower denials, expand affordability, and strengthen cash flow. RCHQ makes it possible with no coding required. Visit rchq.com today.
Welcome back, everyone. Let's jump right in. Thomasina, there is always a specific metric that every RCM executive looks at every morning, right? So for you, is there such an RCM metric and is there such a claims related metric that you look at every day morning?
Yes, I would say not individually, but I look at, my dashboards every single day as soon as I log in. And what am I looking at? I am looking at my cash collected versus, my goal. That's something that I look at. And then I look at what are, based off of my work queues or my dashboard, what's impacting that. And we have our KPIs and our metrics set up to be able to tell us what that is. And that's your watch list. Your watch list is customizable to your organization and your mission. So if in the event that you are not collecting your cash or you're over, that watch list is telling you. So your watch list is customizable to you every single day. So I think that that's very important for a leader to establish what does success look like, customizing your dashboard in order to look at that. And then when you log in, you can see and your focus, what I call it is an anchor. Are you moving in the right direction and is your anchored in the right place? Meaning your strategic focus on a day-to-day. Are you aligning your team, your people, processes, and your technology to align with that success rate at the end of the day? And the only way for you to gauge that is when you log in, you can't really get to your success unless you're monitoring and managing that very well. And that's going to be different for each organization, depending on what the root causes of your non-cash collections is. And for me, that's what I look at every single day. The dashboard, my cash collected today versus my ultimate goal for the month. And then my watch list as to what are the barriers to that cash collections. And those may be different looking at it from day to day. One metric today might not be the metric tomorrow, right?
Yeah, that makes sense.
If you have the right anchors in place, right? The right levers pulled, then as you see those go off, more than likely something else will float in too. But it keeps you on track, keeps you focused, and keep you on the straight and narrow to what you need to do.
Makes sense. And a leader at your level, what do you think are the biggest challenges faced by organizations in bringing step function improvement to denials, right? Normally, you can always make incremental improvements, but what is stopping an organization from bringing step function improvement to denials rates?
I would say it is medical necessity, right? You can improve things that you can make a difference in, right? So in terms of denials, you can get to the things that you can gauge, you can improve at the time of service. But when it comes to patient care, when it comes to maximizing that care, those are things that you can't forego. And as a organization that is mission driven and a safety net in the city of Chicago, one of the highest vulnerable areas, right? This is always going to be on the table for us. We're giving more, in terms of mission, and we're not bringing in as much because we still have to think about the denials at the end of the day. And one of the things that I hope and pray for other leaders around there is to understand that our patients are still being seen. The access to care is still there. And we still have to, I would say, engage our payers to understand, and through peer-to-peers and denial management, at some point in time, that voice will be heard. And they may strategically change those policies. The way that they do that is through appeals and denials management.
Makes sense. And Thomasina, inherently claims denial management programs are complicated, right? Like anytime you bring change, they are complicated. And you have to do a lot of cross-functional coordination. Earlier in the episode, you talked about your experience with cross-functional coordination. How do you build momentum for change with cross-functional teams when you're steering a complex claims denial management program?
Absolutely. So this question is very good because when you serve in a financial seat, most of the time you have, the finance and accounting, they will bring the numbers, right? But I think from an overall perspective, you have to talk about patient care, patient experience, and mission. Start off with your mission. This is the goal every single day: access to care, great patient experiences, excellence in care with compassion. And then show from a denials management perspective, what is the volume? What is the cash impact? So making sure that you break down those layers, and then sharing what your current tools are and what your barriers to being able to get to success are. And with that, you'll understand what are the things you can change from an organization perspective, and what do you need additional help, whether that may be outside support, vendor management, additional vendors, or even get grants or funding, or bringing in more partners that are already there in your organization, engaging for that functionality through that committee or subgroup, that denials management subgroup, which is a think tank of everybody. If revenue cycle is all of us, then you're going to need that feedback as well to ensure that you're gauging the pulse. So I think in order to keep that momentum up, you have to first definitely stay anchored to the mission. This is a collaborated and shared goal. And as we are financially stable and denials decrease, then we are able to help more patients at the end of the day.
Yeah.
As a safety net hospital, some of our patients have to choose between food, water, as well as prescriptions. And as we work as a team, as a mission-driven team, working together at the end of the day and keeping that together and sharing that keeps the momentum there. Share goals, share vision. One team, one approach. Even if you're working with vendors in a partnership, that's where the magic happens. That's where the teamwork happens. And that's what keeps momentum going.
Makes sense. If there is a specific piece of advice that you would like to share with a fellow RCM leader or a CFO who is potentially tackling similar denial management challenges, what would it be?
I would say that collaboration is key. While there are things that you may feel that you can only change on the back end, you're definitely a key resource to be able to socialize that at the front end, bringing your partners from operational and clinical leaders as well. Share with them what your findings are. And I will definitely tell you that they will be a strong partner in helping you resolve it at the time of service.
Makes sense. Thomasina, this episode has been fantastic in that you've shared so many wonderful leadership and general claims denial management insights with our audience. Thank you so much for spending this time with our audience and sharing all these wonderful insights. Our audience are clearly walking away with a lot of wonderful suggestions and insights for the day. Thank you so much.
Thank you for having me.
You're listening to the RC Executive Lounge podcast, the show where healthcare revenue leaders share real-world strategies, hard-earned lessons, and bold ideas shaping the future of revenue cycle. The views expressed by guests are their own and do not constitute endorsement of any specific product or solution.